A very pleasant good afternoon to all of our viewers, and we say welcome to another edition of Let's Talk. We are delighted to be with you, whether you're joining via Second Advent Radio or you are joining via one of our YouTube's channel, SLC Church channel, or SLC Adventists. We welcome you and trust that you are doing well. In Antigua, it is raining a lot. It's a rainy Saturday afternoon, but we are just delighted to be here. Last week, we were not able to be present because of the threat of a hurricane, but today, in spite of the weather, we are here, and we have a very interesting program lined up for you today. Of course, Let's Talk is a program that discusses issues on all sorts of things that impact our members and the wider community. And today we are going to be talking about the issue of infertility. Before I introduce our special guest, I would like to invite you to have a word of prayer with us, shall we? Almighty Father and our God, we thank you for the opportunity and privilege to discuss on today's Let's Talk. We pray for your blessings and your guidance. We ask that you will be with our special guest and grant that the information shared will prove meaningful as we discuss this very challenging subject. Take full control and have your own way in Jesus' name. Amen. Well,
Amen.
friends, as indicated, we are here on Let's Talk. We have a special guest with us this afternoon to discuss this subject of infertility. Our special guest today is Dr. Dane Abbott. He is an Antiguan by birth. He studied medicine at Dalhousie University in Halifax, Nova Scotia, Canada. He also, at Dalhousie, specialized in obstetrics and gynecology and has been in private practice at the Women's Clinic since 1990. He has been a consultant in the Department of Obstetrics and Gynecology since 1992, first at the Halberton Hospital and now at the Sir Lester Bird Medical Center in Antigua. We are delighted to have Dr. Abbott with us. Dr. Abbott, good afternoon and welcome to Let's Talk.
Good afternoon, and thank you very much for having me.
We're delighted to have you with us, Dr. Abbott. I want to begin by asking you, just out of curiosity, I was looking at your background and I noticed that you have been at the Women's Clinic since 1990. What's the Women's Clinic and where can it be found?
So the Women's Clinic is a partnership. In fact, in 1990, when it started, I was with a gynecologist by the name of Dr. Francis Kelsick, who has now died. And so started the practice with her, and it's basically looking after women who are pregnant and women who have gynecological or female problems. After Dr. Kelsick died in 2015, I was joined by another doctor by the name of Dr. Giselle Isaac Greene. And our practice was at the Deanery Place, which is close to Princess Margaret School. Last year, January, we actually moved office from Deanery Place, and we're now located east of KFC in Fort Hood. That's where we are, and we basically look after women who are pregnant and women who have their female problems.
Okay, thank you so much. Happy to hear that. For those of our listeners who are on Antigua, you know where Dr. Abbott's place is located. And as we discuss this afternoon, this very important subject, I'm sure you will make a determination as to whether or not you may need to check him out on something. Well, let's begin this way, Dr. Abbott. You know, in this age where teenage pregnancy is an issue, and many fight for the right to have abortion, it's kind of easy for us to assume that getting pregnant is a no-brainer. Anybody can do that. Over the years, I've come to realize, though, that is not necessarily the case. Let me ask you first. Infertility is an issue for some. I've had a few cases where some married couples were actually hurt by casual comments from others about having children. How common is the problem of infertility, and is it more common in one sex than in the other?
So around the world, infertility affects somewhere between 15 and 20% of women. So that's a significant amount of women. It seems to be about equal in terms of sex. For instance, around the world, studies have shown that when you have infertile couple, 35% of the times, problem is just solely with the woman. The woman has a problem. Then around 30% of the time, the problem is just with the male. And then around 20% of the time, the problem is actually both male and female. And then you're left with about 15% of what we call unexplained infertility, where either the woman or the man doesn't seem to have any problem. So it's a fairly common problem. Somewhere between 15 and 20% of women will have infertility.
It is actually more common than I thought. So that
yes,
15 to 20%, that seems to be quite a significant number. So
absolutely.
Rather very interesting. Well, let's begin with the females. How is infertility defined in a woman? Does it require diagnosis from a medical professional, or is it that somebody just realized they can't get pregnant?
So what studies have shown is that women in their 20s and early 30s who are healthy, who have regular sexual intercourse, and they're trying to get pregnant, after 1 month of trying, about 30% of those women will actually get pregnant. After 6 months of trying, around 75% of women will actually get pregnant. And after 1 year of trying, about 90% of women will actually get pregnant. So the definition of infertility is for a woman between the age of 20 and early 30s, having regular sexual intercourse, and after 1 year, 12 months of trying to get pregnant and not getting pregnant, that is when we diagnose infertility. So women can make that decision themselves. Once they have made that decision, they've been trying for 12 months and they're not getting pregnant, that's when they should seek medical advice to try and find out why they're not getting pregnant. Now, women between the ages of 30 and 35, because they are getting older, and women between that age of 30 and 35, actually between 35 and 40, women that age actually are harder to get pregnant. And so what we now say is that if 6 months go by and a woman is between the age of 35 and 40 and she's not getting pregnant, she shouldn't wait for the full year. She should come into the doctor and be investigated as to why she's not getting pregnant. And any woman over the age of 40 who is wanting to get pregnant, even though she hasn't started trying, she should actually come to the doctor, because those women over the age of 40 are going to be harder to get pregnant and the time is running out on them to get pregnant. So they need to come into the doctor immediately to be investigated. So that's what the definition is. Women less than 35, over a year of trying to get pregnant, infertility. Women between the ages of 35 and 40, after 6 months, no pregnancy, coming to get pregnant. Any woman over the age of 40 considering to get pregnant should come in right away.
I almost hear you saying something that you're not saying directly, and that is that the best time to have children is when you're young.
Absolutely, absolutely. And I always tell women, the best time to have your children is between the ages of 20, when you finish school, okay, and 35, when we consider you to be at higher risk. So 20 and 35 would be the best ages.
All right. Now, of course, we live in a world where we're getting more and more career type women. Women decide they want to pursue a career, they want to pursue their studies, and they postpone marriage to later in life. You are indicating that the older, the closer you get to 35, the more difficult it is going to be to get and sustain a pregnancy, correct?
Absolutely. Yep, that's true. And then once you're over 35 as well, the more complications could arise when you do become pregnant. So we are seeing more and more women, as you say, delaying childbirth, having their first child after 35, or having more children after the age of 35. But those women are actually putting themselves at higher risk in terms of developing diabetes, developing hypertension during the pregnancy, and having an abnormal child, what we call a chromosomal abnormality, where the child may have Down syndrome or one of those chromosomal problems. So women over the age of 35 would be at higher risk for having those problems.
Okay, very interesting. I sense, you know, that there's some. A few days ago, I was in discussion and we were looking at the imbalance. I don't know the theoretical issues. We haven't had a census in Antigua for a while, but it is generally believed that certainly in the church, I'm not sure what happens in the society, that there are more women than men. And we know that a lot of women, even if they may be closer to a balance, a lot of women tend to be more progressive than the men, and are choosing not to marry certain kinds of men. So that is an issue. So some women listening who are getting up in age may be thinking, oh, my time is running out for getting a child. But we will deal with that in a while. Let me ask you another question.
Sure.
Now, what about males? How is infertility defined in the male?
The same way. So basically, if a male is with a woman and after a year she is not getting pregnant, then that's considered infertility. And we do know as the males get older as well, they have a reduced chance of getting a woman pregnant. So that age happens to be somewhere about 40, where they have reduced chance of getting a woman pregnant. But we know that males can get women pregnant up until they're the 70s and 80s. So we've seen that. But there is a reduced fertility in males as they get older as well.
Okay, all right. So we got that covered now. Some females use hormonal-based contraceptives to prevent pregnancy. You know, we were talking just now about the fact that some women want to delay childbirth because they're pursuing a career or they're doing some studies, and they use contraceptive devices. And can prolong the use of the hormonal-based contraceptives lead to infertility, or in any way impact the ability of a woman to either become pregnant or to retain a baby when she gets pregnant?
So let's look at what they use. They use the birth control pill. So the birth control pill is a pill which is taken every day. And what the birth control pill does, it prevents what we call ovulation. It prevents a woman from releasing an egg. So if there's no egg released, then she cannot get pregnant. The birth control pill is very short acting. So most women who stop taking the birth control pill find that the following months, they start to ovulate again. And once they start to ovulate again, they should be able to get pregnant. And there's no problem with them carrying a pregnancy after they've been on the birth control pill for months or years, you know, so that's not a problem. Okay. The other thing that what they call the Depo-Provera. And the Depo-Provera is an injection which is given every 3 months. So the woman can get pregnant, but many women who take the Depo-Provera also don't have period. Sometimes after taking the Depo-Provera for months or years, it takes a while for the Depo-Provera to be cleared out of the system. So sometimes it takes a while for the woman to start ovulating again and producing eggs. And until she starts to ovulate again and produce eggs, she will not be able to get pregnant. So yes, the injection known as the Depo-Provera can delay ovulation in some women and can delay them becoming pregnant once they stop taking it. It can take months, sometimes up to a year before they start having regular periods again. But once they become pregnant, having been on the Depo-Provera doesn't cause them to lose the pregnancy or have any risk of them carrying the pregnancy. But there can be a delay, especially with the Depo-Provera, the injection.
Okay, wonderful. Glad we were able to clarify
that.
Use. I want to ask you another question, just on that. Well, you did indicate that about, I think you mentioned 15 to 20% of women impacted by
infertile.
Yeah,
infertility. Yes.
I came across a term, polycystic ovary syndrome. How does this relate to infertility in females?
Right. So polycystic ovarian syndrome, or PCOS, or we call it PCOS, okay? Polycystic ovarian syndrome. And what it is a condition where women have irregular periods. Sometimes they don't make eggs regularly every month, because women are supposed to make eggs every month. Sometimes they make eggs very infrequently. Sometimes, and because of that hormonal imbalance that is. The second thing which we notice with people who have PCOS is that they tend to have an abundance of male hormones known as testosterone. So instead of the ovaries producing the estrogen and the progesterone, the ovaries start to produce extra male hormone known as testosterone. And so that extra male hormone that these women are producing cause them to have some male characteristics, such as extra hair growth. So you may find that some of these women, they start to have a little more, get hairy chest, they may get some on their back, on the abdomen, on the arms and their legs. And because
a little internet challenge, but we are going to be back in just a while. You stay tuned, don't go anywhere. I think Dr. Abbott is having a little internet challenge somewhere along the line.
And the ovaries are swelling. And so poly means multi or plenty, and cystic means all these cysts in the ovaries. So polycystic ovaries are these ovaries that you see on the ultrasound. So if a woman has any one of those, any two of those three characteristics, which is irregular periods, male androgen, which means the testosterone, hairy growth and stuff like that, acne, or polycystic ovaries on ultrasound, any two of those three conditions, we make a diagnosis of polycystic ovarian syndrome. And because of that, where the woman is not making eggs, it makes her impossible to get pregnant, and infertility is a problem for her. So that's the polycystic ovaries, which is the most common reason why some women are infertile, because they're not making any eggs. So unfortunately, we don't know the cause of the polycystic ovaries. It just happens. We don't know why it happens.
So I lost you for a little while you were responding there. I'm not sure whether our viewers lost you also. At least for my purposes, you did provide a little summary, which I'm trusting what you said. Essentially, that one of the more common reasons why women are infertile is because of this condition. Am I getting you correct?
Right. Okay. Yes, that's correct. So PCOS or polycystic ovary.
Yeah. So what about are there other factors? Are there other reasons why a woman may become infertile?
Sure. So basically, we look at infertility in women as having three factors. So we look at the ovary, which is hormones, and she's not producing eggs, or what we call anovulatory, which means that she's not ovulating or making eggs. So that's one factor. The second factor is what we call tubal factors, because what happens is that once she produces an egg, that egg should be taken up by the fallopian tubes, and then the sperm, which is released inside the vagina, should swim through the uterus and meet that egg in the fallopian tube. If the tube is injured in any way that the sperm and the egg cannot meet, where fertilization occurs, then that can cause problems with infertility. So we look at the ovary producing eggs, we look at the tube, what we call tubal factors, and then we also look at uterine factors. If there's some problem with the uterus, where she may have fibroids, which is causing a distortion of the lining, the inside lining of the uterus, or what we call polyps, which are growths that she gets from the lining of the uterus. And those things can interfere with what we call implantation, where the fertilized egg tries to implant or stick inside the uterus. So we look at ovarian problems, fallopian tube problems, and uterine problems. So those are problems which women can have causing infertility.
Now, Doc, I know of some women who have consistently tried to get pregnant, and they do get pregnant, but they don't keep the baby. So they have what we call miscarriage. Maybe you have a medical term.
Yeah, miscarriage.
Yeah.
Spontaneous abortion, we call it, yeah.
How does that play out? What are the factors there?
So again, we consider repeated miscarriages as a form of infertility. So the women are getting pregnant. So the egg is being fertilized. So the sperm and the egg are meeting. The egg is being fertilized. That fertilized egg is implanted inside the uterus. But for some reason, that pregnancy doesn't progress. The woman gets a miscarriage. Either what we call a first trimester in the first 12 weeks of pregnancy, or sometimes in the second trimester after the 12 weeks. What we do know is that those women who get pregnant and have a miscarriage or spontaneous abortion, we call it medically, in that first 12 weeks of pregnancy, about 50% of the times is because there's something wrong with development of that egg and the sperm. So what we call a chromosomal problem, about 50% of the times. And so women who have what we call repeated miscarriages. So if a woman has 2 consecutive miscarriages, it means that she should be investigated as to find out if she has a problem, why she keeps having these miscarriages. So she's getting pregnant, but having a miscarriage. And so we need to investigate her as to why that keeps happening. There are some women who get beyond the 12 weeks of pregnancy, and they may have what we call a weakened cervix, or what we call cervical insufficiency. And when they get to about 4 or 5 months of pregnancy, the cervix, which is supposed to stay closed until the end of pregnancy, 9 months, it starts to open up. And so those women tend to have a miscarriage as well. So there are certain factors that we have to investigate as to what time the woman has a miscarriage and what could be the cause of those miscarriages.
Okay, now I want to switch to the males, but before I do that, let me just entertain a question here that someone is asking.
Sure.
In relation to what we discussed earlier regarding the older a woman gets, the more difficult it is to get pregnant. The question is,
right.
what is it that makes it increasingly difficult for females to get pregnant as the years go by?
So once a fetus is developing, when that fetus is inside the mother, a female fetus, at around 20 weeks, about halfway through the pregnancy, the ovaries of that female will have about 7 to 8 million eggs. And for some reason, we don't know why, as the pregnancy progresses, those eggs just disappear. They just get used up. We don't know why. So by the time that female girl is born, she only has about 1 to 2 million eggs. So she dropped from 7 to 8 million down to 1 to 2 million. By the time that young girl hits puberty, and we're talking about 11, 12 years of age, all she's left with is 500,000 eggs, 500,000. And as she ages every year, those eggs decrease in numbers. So when she's 11, 12 years of age and she goes through puberty, she has 500,000 eggs. As she gets older and she gets to maybe age 25, 30, she has less eggs. And so the older she gets, the less eggs she has. So that's what makes it more difficult for women to get pregnant. Secondly, those eggs which are left, because they're older, they don't perform as well as the younger eggs. And so they have problems being fertilized, and then problems implanting inside the uterus to continue pregnancy. So that is one of the reasons why we see women as they get older become less and less likely to get pregnant. It's more difficult for them to get pregnant because the eggs are less, they have less eggs, and then the eggs that they have are older and don't perform as well as the younger eggs. So by the time the woman gets 50, she basically has no eggs. So that's why she can't get pregnant again once she hits 50. So every year she gets less and less eggs. She has less and less eggs.
Okay, and the idea is, because we are saying after 35, it becomes so much
Mhm.
challenge that the older the eggs, the less they're able, the more efficiently they're able to perform. That's
Exactly. And then once over 35, because the eggs are old as well, she is more likely to have an abnormal child as well. So that's the other thing that you have to look at as well.
all right.
So
So
the Down syndrome, the chromosomal abnormalities are seen in women over age 35.
so ladies who want to have children should do so in the prime of their life, you know.
Exactly.
All right. Well, let's switch to the men a little bit here,
Mhm.
lest they think that, you know, we are
Leaving them out, sure.
yeah. So we spoke about the common causes of infertility in women. What about in men?
Mhm.
What are the common
So
causes?
in men, so the most common cause we're going to see is problems with the sperm, either with the number of sperm the man produces or the quality of sperm. So you're talking about the quantity of sperm and the quality of sperm. Okay. We do know that men, when they ejaculate, they should have somewhere between 60 and 150 million sperm in that ejaculation that they discharge from the penis once they ejaculate. So if a man doesn't have enough sperm, he wouldn't be able to fertilize the egg, because although you only need one sperm to fertilize that egg, because of the what we call the hostile environment of the vagina, where a lot of these sperm will actually die before they get up to where the egg is. That's why you need a large number. It's like an army, you know. If you're going to invade a country and you have only one person to invade that country, it's going to be difficult. If you have 60 million men to invade a country, then you're more likely that one person will actually get success and get to where that king is, if you're trying to get, or the queen is, which is the egg. And so we find that there are some men who have a low sperm count or no sperm count, no sperm at all in ejaculate. The sperm also have to swim. So once the sperm is deposited inside the vagina, it has to take that long trip through the cervix, through the uterus, into the fallopian tube where it meets that egg. And so the sperm has to be normal and be able to swim and move. And of course, you have to have a normal sperm as well, because the older the man is, the more likely that he may not have a lot of normal sperm. So one of the things we look at men is to try and make sure that they have a good quantity of sperm and a good quality of sperm. So the sperm is what we tend to look at in males if they can't get a woman pregnant.
Now you mentioned there, we try to ensure that that is maintained, quality and quantity. Before we get there though, because I want to ask about that, you know, how do we do that? But before we get there, what would be the factors or reasons why a man would not have any sperm or a low sperm count?
Okay, so infection is one of the biggest things, especially what we call those sexually transmitted infections, such as gonorrhea and chlamydia. Because what infections do, not only they can affect the female and damage the fallopian tubes, but the men also have tubes known as the vas deferens, which carry sperm from the testes to the penis. And so an infection can actually damage that tube known as the vas deferens. And if that tube becomes damaged, either the man may not have enough sperm or have no sperm at all because the tube is so damaged. One of the reasons as well that the testicles are in the scrotum is that the testicles should be cooler than the body to produce enough sperm. So that's why the testicles hang down from the body. So they're cooler than the body. If the testicles are warm like the body, then the testicles don't produce enough sperm or don't produce any sperm at all. And there's certain conditions that can cause that. For instance, there's some men who have what we call these swollen dilated veins known as varicocele around the testicles. And veins, because they carry blood, which are warm, those veins keep the testicles warmer than they should. And once the testicles are warmer than they should, then the testicles aren't going to work the way they should. And that can cause either decreased sperm count or even drop the sperm count to zero. There's some men, for instance, who have a sitting down job. So they sit down all day, especially, for instance, bus truck drivers and so who drive for these long trips in the States, hours upon hours, days upon days, and they sit down. Those testicles get too close to the body. And so the testicles are warmer than they should and may not produce enough sperm. Same thing with men who may wear underwear, tight underwear. And so one of the things sometimes we tell men, use boxer shorts, because boxer shorts don't keep the testicles too close to the body. They keep them away from the body, and that can cause you, to produce less sperm. Lifestyle changes. There's some men who drink too much alcohol can decrease the amount of sperm and the way sperm swim. Marijuana, and lots of people use marijuana, for recreational purposes. That has been shown to decrease sperm count and decrease the motility, the way sperm can move as well. So those are things that we tell men that they have to try and avoid to try and have a good sperm count. And of course, eating properly, getting lots of rest, getting exercise, those are things that will help.
Now you said a few things there that
Yes.
Made me sit up a little bit, because
I'm sure.
I mean, I already have children. I don't even.
Right.
But when you mention, men who sit a lot,
right.
hey, we have come to a place. I mean, our lifestyle. We're not as active as we used to be once upon a time.
Very sedentary. Yep.
You're in your office, you're sitting down, you go home, you sit in your sofa, and you're watching hours of television.
Right.
Now, that's interesting. That's something that perhaps more men need to hear. And then you mentioned the tight clothing, because I remember as a student of biology in I think advanced level, A levels, the whole concept of the sperm needing a cooler environment, and hence it is on the outside of the body. And those very tight clothing can impact the functionality of the sperm. So that is something. Yeah. So now to go back, I want to think that you kind of answered part of the question. You did say earlier that we want to ensure that men maintain good quality and not just quality, but quantity.
Quantity, yes.
Yeah. But then you mentioned alcohol use, you mentioned marijuana. Can you just
marijuana and smoking,
if you will, a little bit more time on that? Because I know that a lot of countries in the world today have decriminalized marijuana. And my observation is, I realize that since marijuana has been decriminalized, that it has been used profusely. So to hear that it can impact the sperm count to some extent, can you just talk to that a little bit?
Sure. I mean, the thing about smoking cigarettes and smoking marijuana is that nobody knows for sure what quantity you have to consume and smoke to cause a problem. And so if we find a man has a low sperm count and he smokes and he drinks alcohol and he uses marijuana, one of the things we say, look, just stop doing those things. Stop the smoking, stop the drinking, stop the alcohol. Because we know from studies that alcohol, smoking tobacco, and smoking marijuana can impact the production of sperm, the quantity of sperm, and the quality of the sperm. So, what we tell people, just stop, because we can't say, well, you should cut back or what. We just tell you stop. If you're trying to get the woman pregnant and you have a problem with your sperm count, you need to stop doing those things and follow a more healthy lifestyle.
Now I'm going to assume that most of our audience do not smoke and do not drink alcohol.
Right.
But, this is a Seventh Adventist sponsored program.
Of course, right.
We advocate no smoking, no use of alcohol, etc. But of course, various persons listen. This is being carried live on
of course
radio, which is a very popular radio station, and lots of folks are listening. And some people do have a problem with the consumption of alcohol and the use of certain drugs. So it is meaningful to understand that lifestyle can impact the way the body functions. Now,
Absolutely.
somebody is asking a question out of curiosity. I think this is on the lady's side. I'm assuming it's a lady who is asking this question. And they did
Sure.
say out of curiosity. Let
Mhm.
me just check the question again to make sure that I'm representing this lady correctly. Out of
Sure.
curiosity, what is done to know how many eggs? I think they're trying to figure out how do you determine how much eggs a woman has or when the egg is finished, when the eggs are finished.
Sure. And I mean, there's some blood tests which some doctors can do to try and see how many eggs, what we call ovarian reserve, how many eggs a woman may have. And so women who are undergoing infertility treatments, well, that's one of the things we can check to see by doing a certain blood test. We can also do an ultrasound as well to look at the ovaries to see if we can see those follicles developing as well. So those are things that we can do to try and check to see how many eggs a woman may actually have.
All right. Now you did mention sexually transmitted disease, and I think you did mention gonorrhea, syphilis. Did you something to that
No,
effect?
gonorrhea and chlamydia. So those are two more common sexually transmitted infections which can damage the fallopian tube in the women and the vas deferens, the tube in the male. So those are two most common sexually transmitted infections that we see doing damage.
Okay. Now I want to think that our listeners are paying attention to that. People ought to know what to do to check to make sure that they are clean and act accordingly.
Right.
Now, if we can say a little bit more about exercise, can excessive weight or inactivity impact infertility in males or females?
Absolutely. I can't say too much about males, but we know for instance, for sure in females. So women who are underweight, women who and women who excess to go to the gym too much, those things can impact your hormones, impact your fertility, preventing you from ovulating. So we find that if a woman is underweight and she's not making eggs, one of the things we tell her, try and put on some weight. If she's overweight and she's not making any eggs, we tell her try and take some weight off. And if she goes to the gym every day and spends 3 and 4 hours in the gym, we tell her, hey, go to the gym and maybe spend an hour, cut back on the exercising. Because we know that those things can impact fertility and make a woman infertile, but without a doubt.
Are there types of food in terms of your diet? Does that have any relationship to infertility in any way?
Well, the diet is what can cause a woman to put on weight. So one of the things that I will tell my overweight patients is that you have to cut back on carbohydrates. So the bread, Antiguans love too much bread, the rice, the pasta, the sweet potatoes, the ground provisions are fine as long as you eat them in moderation, but then the sugary drinks as well. And we know that we have a lot of obese children in Antigua because they eat too much sweets. And those obese children are going to become obese adults. And so we have to put a stop to that. So cut back on the bread, the rice, the pasta, and the sugary drinks. So those things in your diets are bad. You got to cut back on those and replace those with green vegetables and green salads. You can still eat your meat, your fish, whatever you want to eat, your chicken, but you have to cut back on the starches, the carbohydrates, the complex. That's the culprit. Those are the culprits. Those things you have to cut back on.
So we can say that weight management is an essential factor. One needs
Absolutely.
to be careful about that. Now, we didn't talk at all to the emotional aspect of it. Of course, I do know that you are a medical doctor, and your concern is the physiology, how the body functions, etc. But can a man or woman's emotional states impact that as well?
Oh yeah, absolutely. I mean, there's no doubt about it that women and men who are going through and appear they get depressed, they get stressed, they get very anxious. So their infertility and make it worse. Send to the women who come to see me who are pregnant. They're relaxing, having some sex, and then they get pregnant. So therefore, couples who are trying to they have to relax. They have to relax. And unfortunately, here in Antigua, we don't have what we call support groups for infertility. So people will have to go and find counselors, such as in their church, psychologists, psychiatrists, to try and get counseling to try and get them to reduce that stress level, that depression that they go through, that anxiety that they go through. Sometimes they have to get medications to help them as well. But without a doubt, we have seen that once persons can reduce their stress level, not be as anxious, come over the depression, that actually helps them to get pregnant as well.
I want to ask you, Doc.
Mm-hmm.
You mentioned in the case of a woman that
Mm-hmm.
there are three factors or three categories, areas,
Mm-hmm.
having to do with the ovary, having to do with
the tube and the uterus, yes.
And
Mm-hmm.
yeah. So in terms of infection,
Mm-hmm.
we know that infection can come from sexually transmitted diseases.
Mm-hmm.
But where else can infection come from?
Those two infections are basically the ones that we see. Unfortunately, a lot of women have a sexually transmitted infection and they don't even know they have it. Some women with a sexually transmitted infection, they may have an abnormal discharge. They may have a funny smell from the vagina. They may have some itching or burning. But a lot of women have a sexually transmitted infection and don't even know they have it. It's only when we investigate them for infertility, and there's a special X-ray that we do to check on the tubes. It's called a hysterosalpingogram or HSG, that we find out that they have blocked tubes. And then we have to say, hey, I'm very sorry, but sometime in the past, you've had this sexually transmitted infection, either from chlamydia or gonorrhea, which has damaged your tubes, and now your tubes are blocked and you cannot get pregnant. One of the things that they do in the States that we're thinking about trying to get done here is every year, women who are sexually active in the States, they undergo a test checking for sexually transmitted infections. Every year that's done. That's a recommendation. We're not doing that here in Antigua, but it's probably something that we have talked about trying to do, because we do know that a lot of these infections are silent. And if we can catch them early and treat the person early, we can actually prevent them from having damage later on to their tubes. So that's something that we probably need to start looking at.
This question is an interesting one.
Mm-hmm.
A young man and a young woman get married. I almost said pregnant.
Sure.
Get married, having never had sex before.
Mm-hmm.
They are faithful to one another. Can either of them develop a sexually transmitted disease without being unfaithful?
No. So basically, sexually transmitted disease means you have got an infection from somebody who's given it to you, and then you can pass it on to somebody else. So you have to have it through sex. So that's why they call it sexually transmitted. You have to have it from sex. All right.
Now, we spoke about male infertility. Can medication play a role? Sometimes a person is sick, they go to the doctor, they get treated for something, and there's side effects of medication. Can we talk to that?
So one of the things that I normally do, if I see a couple, because a lot of times couples come in to see me, so the male and the female come, and because they're trying to get a baby, they're trying to get pregnant, nothing is happening. So one of the things I first do is send the male to get a sperm test, a semen analysis. If that sperm test comes back abnormal, I tell him you have to go and see a specialist who deals with males. So one of the urologists you'll have to go and see. And what the urologist will do is, of course, examine him, check and make sure that he doesn't have any problem with his testicles, check and make sure he doesn't have any varicocele. These are the veins around the testicles. And then if he doesn't find anything which requires surgery, because the varicocele, those veins, the doctor can operate on those veins and remove them and cool down the testicles, okay? If he finds that he has a problem with blockage of the sperm, then sometimes he can try and unblock unblock the vas deferens, put them back together. So that can be done. But if there's no problem and he just has a low sperm count, then yes, the doctor can actually give him medications to try and increase his sperm count. Same thing, if a woman is not making eggs, she can also get medications which she can take by mouth to make her make eggs so that she can get pregnant as well. So there are medications which can be given for both males and females.
Okay, now, can the opposite happen? Can certain medications that they're using, let's say I have a particular condition and the doctor treats me for that condition, a medication have a side effect that interferes with a man's sperm count or a woman's ability to ovulate properly?
It's possible. So one of the things we always try and do is do a detailed history taking, which means we ask a lot of questions, find out what sort of medication the person has taken. Even if it's over the counter, we want to know, so that and look that up and see if that could be a reason why this male or female having a problem. So yeah, so medications can certainly interfere with that.
Now, some medical conditions may render. Well, let me ask you: if a man has, let's say, prostate cancer or an enlarged prostate, and is treated for that, how can that impact his fertility or create there?
Right. So although semen or sperm, the spermatozoa, they're made in the testicles, and then they sort of travel up the vas deferens, the tube, and they're mixed with prostatic fluid. So fluid from the prostate gland is mixed with the sperm, and then that's ejaculated. If a man is treated and he doesn't have a prostate, or most of the prostate is removed, he may not have that fluid, but the sperm lives in, and the sperm matures in. And so that could be a problem. Also, there are some men, when the prostate is removed, they get what they call retrograde ejaculation. So that means when he's climaxing and ejaculating, instead of the semen and sperm coming out through the penis, it backs up and goes into the bladder. And so that could cause a problem, because if he doesn't have enough sperm or very little sperm, then he will not be able to get a woman pregnant. So prostate problems can certainly impact on a man's fertility. Sometimes he may have an infection in the prostate as well, what we call prostatitis, which interferes with the function and the maturation of the sperm. So those are problems which a male with prostate problems can occur and cause infertility.
So you have a situation now where here is this couple, they're married. Your definition indicates that if after trying for 1 year and they can't get pregnant, that they need somebody. What do? They really want a child, they can't get pregnant.
Right. So they should make an appointment and see a gynecologist, because we are the ones who are specialized in this area. They have what they call a reproductive endocrinologist in the States and Canada and stuff like that. We don't have anybody like that here. So the closest you can get is what we call an obstetrician gynecologist like myself. The male and female, both of you need to come in. The doctor needs to speak to both of you, trying to find out if there's anything from your past that's causing you not to get pregnant. Do an examination on the female. Do a problem. If he doesn't have a problem, consult and find out, one, is she having a problem making eggs? Two, does she have a problem where her tubes may be blocked? Three, and then the most important thing, are they having regular sex? Which means they have to be having sex 3-4 times a week, every 2 days if possible. Because sometimes that's the problem. A woman will come and say, oh, we only have sex once a week because you're always tired. No. If you're trying to make a baby, you gotta be having sex every 2 days, 3 or 4 times a week.
Now, let's just go here again. They come to you, you check them out and discover you discover that there is, let's say, an issue with the male or the female. You direct them to somebody else, or you tell them, here's what you do.
All right. So a lot of times, like I said, the male, I send them off to the urologist. The female, there are certain things that I can do. For instance, if they have a problem with their tubes, I can try and unblock the tubes. if that's possible. If they have a problem where they have a fibroid or polyps, septum, which is a partition inside the uterus, we can try and remove that. If they're not making any eggs, we can try and give them medications for them to make eggs. If we find nothing wrong, what we call unexplained infertility, where we find nothing at all wrong, then one of the options that we give them is to go off to Barbados, where there's an infertility clinic in Barbados, where they can do what they call IVF. IVF means that they can take sperm from the man, if he has sperm. They can take eggs from the woman, they stimulate and take eggs. They put them together in a test tube and then replace that fertilized egg inside of a uterus. The problem with IVF is very expensive. It's about 15 to 20,000 US dollars to have that done. So you got to have money to have that done.
Yeah. Now, I'll probably come back to that now. Let me stay with that.
Sure.
So an individual who does IVF, they're increasing chances, but it's very expensive. Does that also relate? Every now and then you hear of a woman having triplets or 5, 6, as the case may be. Is that associated with that as well?
Sure. So we used to have that a lot. What they're doing these days is that they only try and put in maybe 2 eggs. So the woman may have at least twins, sometimes 3 to make it triplets, but they try not to put in too much eggs inside the woman so that you don't have that problem where you could end up with 5 or 6 children. And then what they'll do, if they say they get 10 eggs from the woman, then they'll freeze those eggs in case she wants to go back again to have more children, or in case the IVF doesn't work. Because although the IVF is so expensive, the success rate, what we call the take-home baby rate. Say if a woman has eggs, no problem taking eggs from her. If her husband or her partner has sperm, no problem taking sperm from him. No problem mixing them together and getting the egg to fertilize. No problem putting that fertilized egg back inside the uterus. But sometimes that fertilized egg doesn't implant inside the uterus, or it does implant and she has a miscarriage. So what we call the take-home baby rate, where a woman who goes through the IVF spends 15, 20,000 US dollars for that program, the chance of her taking baby home and going full term to have a baby is only around 20%. 20%. Not a very good rate for so much money. But if you have the money, that's what you do to try it. And you can't get pregnant, that's what you have to do.
I'm here saying, thank God I have children already. But,
exactly, exactly. But there's some women who can't,
There's a question here. I'm looking at our time. We have just about 7 more minutes, so we're going to be quick on this one.
No problem.
The questions. This question is, can childhood illness affect infertility?
Sure. I mean, if a child is sick, obviously the mother and the father are going to be very worried about that sick child. And any form of stress can upset a woman's hormonal system, either prevent her from ovulating. And men, one of the things that men, when they're stressed out, they have problems either getting an erection or maintaining an erection, or if they can't maintain erection, they have delayed ejaculation. And so stress can certainly affect a couple and prevent that couple from getting pregnant again. So yes, so a sick child obviously would be very stressful for parents and can affect fertility without a doubt.
I'm kind of looking at the question a little differently though.
Sure.
To ask if when I was a child,
okay,
can that impact my body to create challenges for fertility when I grow up?
I suppose it depends on the sort of trauma. I mean, if a child had some sort of trauma, if she was sexually abused, things like that. I suppose as she gets older, memories of that could affect her. We do know that when young men get mumps, for instance, the mumps is something which affects the parotid glands, the glands in the cheek here. But mumps can actually affect the testicles as well. And so men who get mumps can actually cause problems with infertility because they may not produce sperm. So I'm not sure if I'm answering that question. It's satisfactory for that lady. But I suppose, something in the past as a young child can affect somebody when they get older. It might be not physical, but psychological.
Okay, I think you answered the question. At least the person seemed to have indicated that, yes, they were referring to how
Okay, good.
Time. We have time maybe just for one final question, and this really is abortion. Can an abortion, a woman who had an abortion, can that impact her ability to get children? So let's say she got pregnant during teenage.
Absolutely. We know that women who have abortions, sometimes the abortions are what we call unsafe abortions. They're not performed in clean areas. And so there are women who in the past have had infections from having an abortion and can then do damage to either the uterus or to the tubes. And when the uterus and tubes are damaged, then that can also prevent the woman from getting pregnant in the future. We have women who unfortunately may seek abortions from people who aren't qualified to do abortions. And so some sort of damage can be done to the uterus as well. And that damage can lead to them not being able to get pregnant in the future as well. So yes, so without a doubt. And abortions can also weaken the cervix, where the cervix has to be forcibly opened to remove the fetus. And so as a woman becomes pregnant, when she gets into a second trimester, 4 months, 5 months, that weakened cervix cannot hold that pregnancy in, and she may very well have a miscarriage at about 4 or 5 months. So yes, abortion certainly can cause damage and prevent women from getting pregnant or carrying pregnancies in the future.
Okay, thank you so much, Dr. Abbott. It was a joy talking with you. Our time has expired. We are grateful for the—
My pleasure, my pleasure.
I do want to ask you to share your contact information with our viewers, just in case somebody wants to check you out. Maybe somebody is trying to get pregnant and they think they need to come and have a chat with you. Doc, I don't know if you heard me just now. I was saying I was giving you the opportunity to share your contact in the event that somebody wants to get in touch with you. It appears as though we have lost Dr. Abbott.
Yes.
Dr. Abbott, are you there?
Yes, yeah, I'm back. Yeah, we just lost the connection shortly.
So I was saying I'm giving you the opportunity to share your contact in case somebody wants to make contact with you.
Oh, sure, yeah. So it is a women's clinic, and the number there, well, we have 3 numbers. It's 462-4133, 462-3134, no, 462-4133, 462-4134, and 562-4720. So that's a women's clinic.
All right. Thank you so much, friends. Next week,
you're more than welcome.
We are going to be talking next week. We're going to be talking about cervical cancer, the power of the cervix, and how you can deal with that. So be sure to join us next week for another very engaging discussion. We are grateful to Dr. Abbott for having shared with us. And until next week, may God's blessings be yours.
Thank you very much. Thanks for having me.